We're back. I'm Randy Alvarez. You're watching Wellness Hour Live. We're talking about a new procedure for people with chronic back pain, especially those people that have a tough time standing in one place. With us, we have an expert on the topic, board-certified pain management physician. We've had him on before, Dr. Roland Reinhart. Dr. Reinhart, welcome to the program.
Thank you for having me.
So this new program, it's called?
It's called MILD.
MILD.
The MILD procedure.
Okay.
Yeah. Essentially, there's three main reasons for you to have spinal stenosis, which is then pressure on the nerves in the spine.
And it hurts when you stand.
Correct. That's
Okay.
Standing or walking. So the three factors are if you have a bulging disc, which everybody's kind of, talks about herniated disc or bulging disc. But the other things that can cause narrowing around the spine and the nerves are arthritis in the back. And then lastly is thickening of the ligament that runs at the back edge of the spinal canal. And that's called the ligamentum flavum. And as the spine degenerates and the disc degenerate, that ligament will become thicker and may actually buckle in and narrow the spinal canal, putting pressure on the nerves.
Okay.
So this procedure specifically goes in and just resects the ligament, unlike traditional surgery where they actually would cut out the bone, do a laminectomy.
So it creates more room.
Correct. And so hopefully takes the pressure off the nerves, which is really what surgery does as well. As surgery, you're going in, you're cutting out the bone, the ligament, and then the disc. This procedure, though, is much more, is milder, okay, because all we're going to do is go in and resect just the ligament piece and open up the space and hopefully kind of turn the clock back about 5 years or so to where people may be able to move more easily.
What are the results you've seen? Give me one example.
We've really had phenomenal results. Well,
what's a good result?
One of the very first patients we did, she told me that the first morning after the procedure, she woke up and she started crying because she had no pain. That's the first time in 10 years she'd been that way. We're finding that people can walk a lot further, not have pain, can stand a lot longer. Life basically occurs in 15-minute increments. It takes 15 minutes to get up and make a sandwich, 15 minutes to go in and go to the bathroom.
Okay.
So, typically people, until they get to where they're getting under these 15-minute time blocks, that's when they really become debilitated. They really can't participate in life. So this procedure...
And how long will it last?
Well, since we're actually physically, mechanically removing that disc or that ligament, that should, last as well as any other surgery. But you said you could
go back in and...
Right. The nice thing about this is titratable, meaning that, with surgery, if you're going to go in, God hopes we just go once, right? But if you're going to go in and you're going to take out the bone, the ligament, everything at one time, and hopefully that's the right procedure. With this, we can actually go in and resect just the ligament on the left side. Then if that's not enough, you can resect it on the right. Then you can resect a different level.
And what's the downtime, by the way? Because
zero.
We have a minute left.
Downtime is zero.
So you can walk out of there.
Patients walk out, and the next day they have nothing.
So MILD, it's called MILD.
MILD procedure.
Is there a M-I-L-D?
MILD procedure.
And they could find out, is there a website they could learn more about this?
Vertos is the company that makes that. So if you go to Vertos, VERTOS.com, you can see the whole procedure, and there's a whole information.
Call your doctor, see if
maybe MILD would be the right thing for you. And again, there are other reasons for you to have back pain and so on. And again, if you go to a board-certified physician, they can help kind of sort those out. But this may be a procedure that could save you, a spine surgery, save you a lot of downtime, and is certainly worth looking into.
Okay, good. I want to thank you for coming to the show. Very interesting.
Thank you for having
Always
me.
a pleasure. You're watching the Wellness Hour Live. I'm Randy Alvarez. We'll be right back.